What if I told you that the most powerful pharmacy you've ever had access to isn't a building with fluorescent lights and a drive-through window? It's your kitchen, your pantry, the back of your grandmother's cabinet. We're talking about remedies so effective that soldiers use them on battlefields, so reliable that they were passed down through generations before anyone even knew what a germ was, and so forgotten that most people today would laugh at them right up until the moment they actually work. But here's what nobody tells you. Some of these aren't just folk tales. Modern research is quietly confirming what our great-grandparents already knew. These remedies work then, they work now, and they're sitting in your home right this second. Stick around because number 18 on this list was literally used by dentists before modern anesthesia existed. And the active compound is still in dental products today. And number 20, it was used in medieval Europe for some of the nastiest infected wounds imaginable. And it works on the same principle as hospital-grade wound dressings. Let's get into it. Here are 20 forgotten remedies that will heal you instantly, ranked from impressive to absolutely unbelievable. Garlic honey ferment, the kitchen antibiotic. Let's start with one of the most powerful things you can make at home with just two ingredients you probably already have. Garlic honey ferment is exactly what it sounds like. Crushed raw garlic submerged in raw honey and left to slowly ferment for weeks. It looks simple. It sounds simple, but what happens inside that jar is nothing short of remarkable. Garlic contains a compound called allicin, one of the most studied natural antimicrobial substances on Earth. Raw honey has its own antimicrobial properties, including hydrogen peroxide production and a low water activity that kills bacteria. When you combine them and let them ferment, something interesting happens. The garlic mellows, the honey liquefies, and deepens in flavor. And both ingredients exchange and amplify each other's medicinal properties. Traditional healers across Eastern Europe, the Middle East, and Asia kept some version of this preparation on hand for winter illnesses, sore throats, and infections. Before antibiotics, this was frontline medicine. Modern research backs the core mechanisms completely. Allicin has documented antibacterial, antiviral, and antifungal activity. Raw honey has been studied in wound care settings. Together, they're not just additive, they work synergistically. Here's how you make it. Crush an entire head of raw garlic, submerge it completely in raw local honey in a clean jar, seal it loosely to let gases escape, and leave it at room temperature for 3 to 4 weeks, turning the jar daily. At the first sign of a cold, a sore throat, or any infection, take 1 clove with a spoonful of the fermented honey. It's the medicine cabinet that gets better the longer you ignore it. This remedy got forgotten because it requires patience, and it can't be patented. But the two-ingredient pharmacy that your great-grandparents relied on is still just as powerful today as it ever was. Think of it as a slow cooker antibiotic. The longer it sits, the stronger it gets. Onion poultice, the chest clearer. This one sounds so old-fashioned that most people dismiss it immediately. Crushed warm onions wrapped in a cloth and applied to the chest or the soles of the feet. Sounds like something a grandmother would insist on while everyone rolled their eyes. But here's the thing. Grandmothers were right. Onions contain sulfur compounds, the same family of compounds that make garlic so powerful medically. When onions are warmed and crushed, those sulfur compounds become volatile, meaning they release into the air and into the skin. Applied to the chest, they penetrate the tissue, stimulate circulation, thin mucus, and reduce inflammation in the bronchial passages below. Traditional European medicine, especially in Russia, Germany, and Eastern Europe, used onion poultices as a serious treatment for deep chest colds, bronchitis, and childhood croup. This wasn't a superstition. It was a medical procedure performed by healers who had watched it work for generations. Modern research has confirmed that volatile sulfur compounds from alliums have genuine anti-inflammatory and mucolytic effects, meaning they break up mucus. The heat of the poultice also increases circulation to the area, speeding healing. Here's how to do it. Slice or crush 2 large onions. Warm them gently in a pan. Not cook them, just warm. Wrap them in a layer of cloth and apply to the chest for 20 to 30 minutes. For feet, same process. Wrap the warmed onions against the soles, cover with wool socks, and sleep. This remedy got forgotten because it smells. That's it. That's the whole reason. But when you're on day 4 of a chest cold that won't break, a little onion smell seems like a very fair trade. Think of it as the remedy that works so well it had to be abandoned because it offended our modern sensibilities. Fire cider tonic, the inferno in a bottle. Fire cider is the remedy that people either swear by completely or have never heard of at all. There's almost no in between. The basic formula: apple cider vinegar infused with raw garlic, fresh ginger, prepared horseradish, hot chili peppers, and sometimes onion, turmeric, and black pepper. You let it infuse for 4 weeks, strain it, and take it by the tablespoon at the first sign of a cold, sinus infection, or sluggish immune system. The name is accurate. It tastes like fire, but it works like a rocket. Every ingredient in fire cider is independently documented to have antimicrobial, circulation boosting, and immune stimulating properties. Apple cider vinegar creates an acidic environment that many pathogens can't survive. Garlic and its allicin kill bacteria and viruses. Ginger has powerful anti-inflammatory and warming effects. Horseradish is one of the most potent natural decongestants known. The compounds in it literally blast open sinus passages. Capsaicin from chili peppers stimulates circulation and triggers the immune system. Together, they form what might be the most comprehensive cold-fighting tonic in traditional medicine. Folk healers in Appalachia, New England, and throughout Europe kept variations of this under different names for centuries. Here's the preparation. Roughly chop a full head of garlic, a large piece of ginger root, several tablespoons of fresh horseradish, and a handful of hot peppers. Pack them into a jar. Cover completely with raw apple cider vinegar. Seal and let infuse for 4 weeks, shaking daily. Strain, add honey to taste, and take 1 to 2 tablespoons at the first sign of illness. Fire cider got forgotten because it requires effort and time, and it can't be reduced to a single active compound. But the tonic that Appalachian folk healers kept in their cellars is still the most comprehensive natural immune weapon most people have never tried. Think of it as the remedy that's so intense it practically frightens illness away. Mustard foot soak, the fever drawer. Here's one that seems almost too simple. Hot water, powdered mustard, your feet. That's it. But before you write it off, consider this. Mustard foot soaks were used in military medicine and in European folk practice for decades as a fast, effective way to address fever, head colds, and fatigue. Nurses in field hospitals used them. Midwives recommended them, and they worked consistently enough that people kept doing it. Mustard contains compounds called isothiocyanates, which are potent circulatory stimulants. When dissolved in hot water and applied to the feet, these compounds penetrate the skin, dramatically increasing blood flow to the extremities. This draws blood from the congested head and chest, reduces the pressure of a fever, opens capillaries, and stimulates the kind of sweating that helps your body process and eliminate infection. The feet have some of the largest pores on the body and some of the most reactive circulatory responses. What you apply to the feet affects the whole body faster than almost any other external treatment. Here's the method. 2 tablespoons of dry mustard powder in a basin of water as hot as you can comfortably tolerate. Soak for 20 minutes while wrapped in a warm blanket. Drink hot water or tea simultaneously. Expect a sweat. That's the point. Mustard foot soaks got forgotten because they're not glamorous and because pharmaceutical fever reducers are faster. But for the kind of low-grade fever and bone-deep fatigue that comes with a head cold, a mustard foot soak can shift your trajectory in a single evening. Think of it as a circulatory reset that starts from the ground up. Charcoal poultice, the toxin magnet. Activated charcoal gets attention today for smoothie bowls and Instagram teeth whitening. But the real history of charcoal as medicine is far more serious than that. For centuries, healers used charcoal poultices, activated charcoal mixed with water or flaxseed meal into a paste, and applied to infected wounds, spider bites, bee stings, and areas of skin infection. The mechanism is real and it's well understood. Activated charcoal is extraordinarily porous at a microscopic level, and it binds toxins, bacteria, and inflammatory compounds through a process called adsorption, pulling them out of tissue and holding them. This isn't folk mythology. Activated charcoal is used in modern emergency medicine today for poisoning. The same mechanism works externally on localized infections and bites. Traditional healers in North America, Europe, and indigenous cultures worldwide independently discovered charcoal's drawing properties. When a wound was infected and there was nothing else, a charcoal poultice applied overnight could visibly reduce redness, swelling, and discharge by morning. Here's the preparation. Mix activated charcoal powder with just enough water to form a thick paste. For better adhesion, add a spoonful of ground flaxseed. Spread onto a cloth, apply to the affected area, cover with another cloth layer, and leave for several hours or overnight. Charcoal poultices got forgotten partly because they stain everything they touch, an absolute irreversible black. But for infected bites, stubborn skin infections, and toxin exposure, this is one of the most scientifically grounded folk remedies on this entire list. Think of it as the world's smallest vacuum cleaner, pulling everything harmful right through the skin. Saltwater gargle, the ancient version. You've heard of saltwater gargles, but the ancient version was different and more effective. Basic warm saltwater gargle is well established. It kills bacteria, reduces inflammation, and draws fluid out of swollen throat tissue through osmosis. But traditional healers didn't stop there. They added a splash of raw apple cider vinegar, which changes the pH and increases antimicrobial potency. Some added a pinch of turmeric, which has documented anti-inflammatory effects. Some added a drop of herbal preparation. The result wasn't just a salt rinse. It was a full therapeutic gargle that worked on multiple mechanisms simultaneously. Osmotic pressure drawing out swelling, acidic pH disrupting bacterial membranes, and anti-inflammatory compounds directly contacting inflamed tissue. Ancient Greek physicians recommended sea salt gargles. Medieval healers routinely prescribed them for tonsillitis and mouth infections before any surgical option existed. They worked because the mechanism is simply real and consistent. Here's the enhanced version: a full teaspoon of sea salt in 8 ounces of water, as warm as you can handle, a tablespoon of raw apple cider vinegar, and a quarter teaspoon of turmeric if you have it. Gargle for 30 seconds, 4 to 6 times daily. Don't swallow. The ancient salt gargle got downgraded to a mild folk remedy when we developed antibiotics for throat infections. But for the first 48 hours of a sore throat, before you even know if it's bacterial, this gargle can stop an infection in its tracks. Think of it as the original antiseptic mouthwash that actually works on the infection, not just the smell. Vinegar compress, the fever cooler. Before acetaminophen, before aspirin, before any pharmaceutical fever reducer, people used vinegar compresses. And they used them because they worked. A cloth soaked in diluted apple cider vinegar and applied to the forehead, the back of the neck, or the wrist works through 2 simultaneous mechanisms. First, the evaporation of the vinegar cools the skin surface, drawing heat away from the body exactly the way sweating does, but faster. Second, the acetic acid in apple cider vinegar has genuine anti-inflammatory properties that reduce the inflammatory signaling driving the fever. Traditional nurses throughout the 1800s and early 1900s routinely used vinegar compresses for fever patients. They weren't practicing medicine in the modern sense, but they were doing something that consistently helped, and clinical observation over decades confirmed it. Midwives, folk healers, and household remedy guides universally included vinegar compresses for fever. The same compress applied to the temples and base of skull was used for headaches. Applied to sunburned skin, the acetic acid neutralizes alkaline compounds from sun damage, reduces inflammation, and provides significant pain relief. Here's the method. 1 part raw apple cider vinegar to 2 parts cool water. Soak a cloth, wring it partly, apply to forehead and wrist for fever or to sunburned skin, refreshing every 10 minutes as it warms. The vinegar compress got replaced by pill-form fever reducers that are faster and require no effort. But for mild fever management in children, in people who can't take medications, or as a natural complement, the vinegar compress still does exactly what it's always done. Think of it as the original cool-down protocol that your body already understands. Herbal steam inhalation, the respiratory reset. This is one of the oldest and most universally practiced folk remedies in human history, and it's still one of the most effective things you can do for your sinuses and lungs. Boiling water, herbs, a towel over your head. Simple as that, but the specific herbs matter enormously. Thyme contains thymol, one of the most potent natural antiseptics known. So powerful, it's the active ingredient in commercial antiseptic mouthwashes. Inhaled as steam, thymol contacts your mucous membranes directly, killing pathogens, reducing inflammation, and thinning mucus. Eucalyptus contains cineol, a compound that opens airways, reduces inflammation, and has documented antiviral activity. Peppermint contains menthol, which immediately signals cold receptors in your airways to relax and open. Traditional healers used herbal steam inhalations for respiratory infections, sinus congestion, bronchitis, and head colds for centuries. There was no mystery about why. You could feel it working within minutes. Modern research on the individual compounds confirms all of it. Thymol is antimicrobial, cineol is anti-inflammatory and mucolytic, and menthol is bronchodilatory. Together in steam, they deliver directly to where the infection is. Here's the method. Bring water to a boil. Add a tablespoon each of dried thyme, eucalyptus leaves, and peppermint. Remove from heat. Set on a stable surface. Lean over the pot. Cover your head in the pot with a towel and breathe slowly and deeply for 10 to 15 minutes. Do this twice daily for sinus infections and chest colds. Herbal steam got forgotten because it takes 10 minutes. It messes up your hair, and it requires actually being uncomfortable for a moment. But for sinus infections and chest colds, it delivers medicine directly to the source in a way that no pill can replicate. Think of it as the only delivery system that gets your medicine exactly where the problem is. Egg yolk I poultice, the old European remedy. This one gets the most skeptical looks of anything on this list. A warm egg yolk wrapped in thin cloth placed over a closed eye. It sounds like something from a fairy tale, but this old European remedy, used particularly in Eastern Europe and in traditional German household medicine, was trusted for treating styes, inflamed eyelids, and early eye infections for generations. And when you understand the mechanism, it makes complete sense. A stye is a blocked oil gland at the base of an eyelash, usually infected by staph bacteria. The treatment in modern medicine is warm compresses, moist heat applied repeatedly to soften the blockage, increase circulation, and bring the infection to a head. Egg yolk, warm and wrapped in thin cloth, provides exactly that. Sustained, moist heat with remarkably consistent temperature. The lipids and proteins in the yolk hold heat longer than a plain water compress and release it more evenly. Traditional healers also believed the nutrients in the egg yolk were absorbed through the thin eyelid skin and aided healing. While that's harder to prove, the moist heat mechanism is completely sound. Here's the method. Separate a raw egg yolk. Wrap it in a single layer of fine cloth or muslin. Warm it very gently, body temperature, not hot, and apply over the closed eye for 15 to 20 minutes. The yolk maintains gentle, consistent warmth throughout. The egg yolk poultice got replaced by sterile gauze warm compresses, which work on the same principle. But the folk version was cheaper, more effective at holding warmth, and available anywhere eggs were kept. Think of it as the original targeted heat therapy designed specifically for the most delicate tissue on your face. Honey and black pepper mix. The cough silencer. 2 pantry ingredients, no cooking required. One of the most effective natural cough remedies ever devised. Raw honey alone is documented to outperform dextromethorphan, the active ingredient in most over-the-counter cough medicines, in multiple clinical trials for reducing nighttime cough in children. The World Health Organization even lists honey as a cough remedy. The mechanism involves coating and soothing irritated throat tissue while also delivering antimicrobial compounds directly to the site of infection. Black pepper adds something completely different. Piperine, the active compound in black pepper, is a potent circulatory stimulant applied to mucous membranes. It dilates blood vessels, increases warmth, stimulates immune activity, and breaks up congestion. It's also a natural antihistamine, which is why it makes you sneeze. It literally forces your body to clear airways. Traditional Ayurvedic medicine has used honey and black pepper together for respiratory complaints for thousands of years. Folk medicine across Asia and Europe independently arrived at the same combination. The heat of the pepper and the soothing of the honey create a perfectly balanced therapeutic effect. Here's the method. 1 tablespoon raw honey with 1/4 teaspoon of freshly crushed black pepper mixed together and taken slowly. letting it coat the throat. Repeat every 2 to 3 hours during illness. Honey and pepper got forgotten because we decided cough medicine needed to be a syrup in a measuring cup with a childproof cap. But this two-ingredient remedy that fits in a shot glass has been quieting coughs for millennia. Think of it as the cough drop that fights the infection at the same time it soothes the symptom. Potato slice fever draw, the root cellar remedy. Sliced raw potatoes on the forehead. This is the remedy that gets the most eye rolls. It sounds like the dictionary definition of an old wives' tale. But here's why it keeps showing up across completely unrelated cultures. Eastern European folk medicine, Latin American traditional healing, rural Appalachian practice, all independently landing on the same potato. Raw potato is naturally cool, and it holds that coolness consistently because of its high water and starch content. Applied to the forehead or the soles of the feet, it provides sustained, gentle cooling without the abruptness of ice. It also draws warmth from the skin through gentle conduction. The same physical principle that makes cool compresses work. The high water content means it doesn't dry out quickly. The starch creates a slight drawing effect on the skin surface. And unlike a wet cloth, it stays in place and maintains its temperature longer. Traditional healers in multiple cultures also applied potato slices to the feet during fever, believing that the feet were a gateway to the body's temperature regulation. Modern understanding of circulation and peripheral vasodilation actually gives this some support. Cooling the extremities does help reduce core temperature. Here's the method. Slice a raw potato into 1 or 4-inch rounds. Chill slightly if desired. Place on the forehead and replace as they warm. For feet, place slices on the soles and cover with cotton socks. The potato fever remedy got forgotten because ibuprofen works faster. But for mild fever management for children who can't take medications or as a complementary approach alongside other treatment, the potato slice does exactly what it's supposed to. Think of it as the root cellar pharmacy stocked and ready in every kitchen on earth. Castor oil pack, the deep healer. Castor oil packs are the remedy that serious herbal practitioners and naturopaths have quietly maintained through every decade of modern medicine. They never fully disappeared because practitioners kept seeing them work. The method: cloth saturated in castor oil applied to the abdomen, covered with plastic wrap, and then a heat source, a hot water bottle or heating pad, applied on top, left in place for an hour or more, done 3 to 4 times per week for chronic conditions. Castor oil contains ricinoleic acid, a compound with documented anti-inflammatory effects. When applied with heat and left for extended time, castor oil penetrates deeply into tissue. Research has shown that castor oil packs increase lymphocyte activity, the white blood cells central to your immune response in the tissue beneath. They appear to promote lymphatic circulation, which is the body's internal waste removal and immune surveillance system. Traditional uses include digestive complaints, constipation, uterine fibroids, ovarian cysts, liver congestion, and general inflammation. Edgar Cayce, the American folk healer, popularized them in the early 20th century, but variations of the same practice appear in Ayurvedic and traditional European medicine. Modern naturopathic practitioners use castor oil packs routinely. The lymphatic stimulation mechanism has enough research backing that it can't be dismissed. Here's the method. Soak a piece of flannel cloth in cold-pressed castor oil, place it on the abdomen, cover with plastic and apply heat for 60 to 90 minutes. Rest completely during the process. Castor oil packs got ignored by conventional medicine because they're slow. They require patience and you can't standardize a dose. But for chronic digestive and inflammatory conditions, they offer something pharmaceuticals often don't: support for the body's own cleaning and immune systems. Think of it as a tune-up for your internal drainage system, the one nobody thinks about until it stops working. Burnt bread remedy, the original charcoal. This one sounds so strange that it almost defies explanation. Lightly charred bread, burnt toast, essentially applied to minor wounds and infections. But when you understand what's actually happening, it makes complete sense. Charred bread is at a basic chemical level a form of carbon. Not as refined or porous as activated charcoal, but functionally similar. Traditional healers who applied charred bread to infected cuts and drawing wounds were using the same absorption principle. Carbon binds bacterial toxins and draws them from tissue. In the era before antibiotics, when any wound could turn septic, a charred bread poultice applied overnight and changed daily could visibly reduce the signs of early infection. Redness, swelling, heat, and discharge. Not because the bread had specific medicinal compounds, but because the carbon was doing what carbon does, binding and removing whatever was causing the problem. This remedy appears in rural European folk medicine, in old American household guides, and in various traditional healing traditions globally. It was especially common for children's wounds and for working people without access to any formal medical treatment. Here's the method. Burn a piece of bread until it's fully charred, but not crumbling. Let it cool. Apply to the wound surface. Cover with clean cloth and leave for several hours. Change 2 to 3 times daily. The burnt bread remedy got forgotten when sterile wound dressings and antibiotic creams became available, but it works on the same principle as activated charcoal dressings that are still used in modern wound care. Think of it as the accidental discovery of wound treatment that people found empirically centuries before anyone understood why it worked. Thyme tea concentrate, the natural antibiotic brew. If there's one herb that crosses the line from folk remedy into pharmaceutical territory, it's thyme. Thymol, the primary active compound in thyme, is the same compound used in Listerine, in commercial antiseptic solutions, and in some pharmaceutical cough preparations. The antimicrobial potency of thymol against respiratory pathogens is so well established that European Commission regulatory bodies have formally approved thyme preparations for the treatment of coughs and upper respiratory infections, not as a folk remedy, but as a recognized medical treatment. Traditional use across the Mediterranean was universal. Thyme was the respiratory herb for bronchitis, whooping cough, chest infections, and croup. Strong thyme tea was the first treatment reached for. It worked because thymol, inhaled as steam from hot tea, and then swallowed to contact throat and bronchial tissue directly, kills the bacteria and viruses causing the infection. The difference between a thyme tea and a true thyme concentrate is significant. Weak tea barely releases the volatile oils. Concentrate made by steeping a large amount of dried thyme in just boiled water, covered for 15 minutes, releases and retains the full therapeutic dose of thymol. Here's the method. Pack a full 2 tablespoons of dried thyme into 8 ahs of just boiled water. Cover immediately and steep for 15 minutes. Covering is critical to keep the volatile oils from escaping. Strain and drink hot with honey 3 times daily during illness. Thyme tea got displaced by commercial cough preparations, many of which contain thymol anyway. The difference is you can make yours at home in 5 minutes for pennies. Think of it as having a licensed pharmaceutical-grade respiratory treatment growing in your herb garden. Cabbage leaf wrap, the swelling solver. Cabbage leaves wrapped around swollen joints, applied to inflamed breast tissue, packed around arthritic knees. It sounds like desperation medicine, but there's a reason this remedy persisted for centuries across completely unrelated cultures. Cabbage leaves contain compounds, primarily sulfur and glucosinolates, that have genuine anti-inflammatory properties. They also have a structure that makes them uniquely effective as a topical treatment. They're flexible enough to conform to body contours. They hold moisture at the skin surface, and when slightly wilted or crushed, they release their compounds into the skin. Multiple clinical trials, real published, peer-reviewed studies have examined cabbage leaf wraps for breast engorgement in breastfeeding women, for osteoarthritis of the knee, and for ankle sprains. The results are consistently positive. Swelling decreases faster with cabbage leaf wraps than with standard treatment in several trials. This isn't folk medicine anymore. It's published evidence. Traditional use across Europe, particularly in Germany, Eastern Europe, and Russia, included cabbage poultices for virtually any kind of localized swelling and inflammation. Infected wounds, arthritic joints, sprains, and mastitis. Midwives recommended cabbage leaves for postpartum breast engorgement, and modern lactation consultants still do. Here's the method. Chill a whole head of cabbage. Remove outer leaves. Roll a wine bottle over them to slightly bruise and crack them. This releases the compounds. Apply directly to swollen area. Cover with a bandage and leave for 2 hours. Repeat twice daily. Cabbage leaf wraps got ignored because frankly, walking around with cabbage leaves tied to your knees is difficult to take seriously. But the clinical evidence says that's exactly what you should be doing. Think of it as the grocery store pharmacy that's been proven in clinical trials and laughed at in conversation. Alum application, the mineral medicine. Alum, or potassium aluminum sulfate, is a naturally occurring mineral that was used medically for centuries before it became a food preservative and deodorant. Traditional healers applied it to cuts, razor nicks, minor wounds, and mouth sores. And it did something remarkable. It stopped bleeding almost immediately and closed tissue against infection. The mechanism is pure chemistry. Alum is a powerful astringent. It causes proteins in tissue to contract, literally tightening cells and closing small blood vessels at the surface of a wound. This stops bleeding. It also creates a chemical environment hostile to bacteria by lowering pH and drawing moisture out of microbial cells. Traditional barbers kept alum blocks on their counters for exactly this reason. A razor nick touched with alum would stop bleeding in under 30 seconds. Applied to mouth ulcers and canker sores, alum draws fluid from the inflamed tissue, reduces swelling, and creates a protective layer over the wound. Many people report that a single alum application to a canker sore in its early stage prevents it from fully developing. Traditional use spans ancient Greek medicine, Ayurvedic practice, traditional Chinese medicine, and European folk healing. It was described in medical texts as far back as the 1st century AD. Here's the method. For cuts, wet the alum stone and press to the wound for 30 seconds. For mouth sores, apply a pinch of powdered alum directly to the sore for 60 seconds, then rinse. For a shaving nick, a wet alum stone passed over the cut stops bleeding immediately. Alum got forgotten as a medicinal mineral when styptic pencils and antiseptic creams took over. But it's still sold in pharmacies as an aftershave product, and it still works exactly the way it always did. Think of it as the original surgical hemostatic in a pocket-sized mineral form. Ginger compress, the pain and stiffness fighter. We're in the top 4 now, and these are the ones that genuinely change people's minds about what natural medicine can do. A ginger compress sounds simple. Cloth soaked in ginger-infused hot water and applied to the body. But what it does to the tissue beneath is anything but simple. Ginger contains gingerols and shogalls, compounds with some of the most well-documented anti-inflammatory effects in the entire botanical world. Hundreds of clinical trials have studied ginger for pain and inflammation, but topical ginger, as opposed to ingested ginger, works through a different pathway. Direct penetration into superficial tissue, triggering immediate vasodilation, the expansion of blood vessels, and dramatically increasing local circulation. Increased circulation to an area means more oxygen, more immune cells, faster removal of inflammatory compounds, and direct warmth to tense muscle and joint tissue. For the deep aching of arthritis, the stiffness of muscle injury, and the cramping of menstrual pain, a ginger compress applied with heat can provide relief within minutes that is qualitatively different from anything you take by mouth. Traditional use in Japanese Kampo medicine and in Chinese traditional practice was extensive. Ginger compresses were applied to arthritic joints, injured muscles, and areas of chronic pain. The mechanism was understood empirically. Ginger creates heat from within. Here's the method. Grate or slice a large piece of fresh ginger. Simmer in water for 10 minutes without boiling. Soak a cloth in the hot ginger water, wring partly, and apply to the painful area as hot as comfortably tolerated. Cover with dry cloth to hold heat. Replace every 5 minutes for 20 minutes. Ginger compresses got replaced by heating pads and topical pain creams. But the active warming and anti-inflammatory compounds in ginger do something synthetic heat alone can't. Think of it as the remedy that creates its own fire from the inside out. Clove oil tooth remedy, the dentist in a bottle. And here's the one I promised you at the start. The remedy that professional dentists used before modern anesthesia. The one whose active compound is still in dental products, sold in every pharmacy today. Clove oil for toothache. Cloves contain eugenol, a compound so effective at blocking pain signaling in nerve tissue that it's classified as a local anesthetic and analgesic. Applied directly to an exposed nerve or inflamed gum, eugenol bonds to nerve receptors and blocks pain transmission. The effect can be felt within seconds. This wasn't folklore. Clove oil was the primary dental anesthetic throughout the 1800s and into the early 1900s. Professional dentists used it before synthetic lidocaine existed. It was standard in dental practice, and eugenol is still present in dental cements, root canal sealers, and dental packing materials used in dentistry today. Traditional use was universal wherever cloves were available. Press a whole clove against a sore tooth and let it sit. Soak a small cotton ball in clove oil and pack it against the inflamed area. The pain diminished fast enough that people trusted it completely. Modern research has fully confirmed the mechanism. Eugenol is also anti-inflammatory and antimicrobial, meaning it doesn't just mask dental pain, it acts on the infection or inflammation causing it. Here's the method. Place a drop of clove oil on a small cotton ball and apply directly to the aching tooth or inflamed gum. Alternatively, place a whole dried clove against the tooth and bite gently. The numbing effect begins within 30 seconds and lasts 30 to 60 minutes. Clove oil got pushed aside by commercial dental numbing gels, many of which contain eugenol anyway. You're already using clove medicine. You're just buying it in a tube with a pharmaceutical label. Think of it as the original dental anesthetic that's been in your spice cabinet this whole time, quietly waiting to be remembered. Rice water wash, the gentle healer. Rice water is one of those remedies that sounds almost too humble to be real medicine. Water left over from soaking or boiling rice. That's it. But this simple liquid has two completely different and well-documented uses that have been validated across centuries and cultures. Applied to the skin as a wash or compress, rice water soothes irritated, inflamed, and eczema-prone skin remarkably effectively. The mechanism involves inositol, a compound in rice that supports skin barrier function, along with starchy compounds that form a protective film over irritated tissue, reducing water loss and shielding damaged cells. Japanese and Korean beauty traditions built entire skincare philosophies around fermented rice water. Clinical research on rice water for atopic dermatitis shows measurable improvement in skin barrier function and reduction of inflammation. Taken internally, drunk during digestive illness, rice water provides something different. Easily absorbed carbohydrates, a small amount of electrolytes, and a coating, soothing effect on inflamed intestinal walls. In cholera epidemic responses, historically rice water was used to maintain hydration and support gut function. The World Health Organization has studied oral rehydration formulas based on rice water. Two completely different problems, one simple preparation. Here's the method. Soak 2 cups of uncooked white rice in 4 cups of water for 30 minutes, then strain. For skin, apply the strained water as a wash or soak a cloth and use as a compress. For digestive illness, drink the rice water warm with a small pinch of salt. Rice water got forgotten as medicine because it became associated purely with cooking and skincare. But the remedy that helped human populations survive infectious diarrhea epidemics and soothe inflamed skin across every continent is still as effective as it ever was. Think of it as the most humble medicine on earth, the one that was so basic everyone forgot it was medicine at all. Bread and milk poultice, the boil drawer. And here we are, number 20. The one I saved for last because it represents the oldest tradition in all of folk wound care. Bread soaked in warm milk and applied to infected skin, to boils, to splinters buried deep in tissue, to wounds beginning to abscess. This sounds like desperation, like something you do when you have absolutely nothing else. But this remedy was used by wound healers in medieval Europe, in colonial America, in frontier medicine, and in early 20th century household care because it worked consistently enough that healers kept using it through generations. And when you understand the mechanism, the logic is elegant. Warm milk softens tissue, particularly the hardened keratin that forms over and around boils, splinters, and embedded infections. This is critical. A buried splinter or a forming abscess is surrounded by a hardened tissue fortress, and nothing will draw it out until that fortress softens. Milk's lactic acid and proteins create the sustained, gentle moisture needed to fully soften even the deepest tissue resistance. Bread acts as a vehicle and a poultice base that holds the warm milk against the skin for an extended period, maintaining consistent heat and moisture. The carbon from the bread, particularly if slightly stale or day-old, adds a small drawing effect. The combination creates conditions where the body's own processes can complete. The abscess comes to a head. The splinter migrates toward the surface. The infection draws outward rather than deeper. Traditional healers understood this empirically. Modern wound care confirms the mechanism. Moist heat consistently applied draws out exactly what needs to come out. Here's the method. Tear a slice of bread into a small bowl. Pour warm milk over it until completely soaked and soft. Apply the warm poultice directly to the boil, infected wound, or splinter area. Cover with cloth and leave for several hours or overnight. Replace twice daily. Within 1 to 2 days, most boils have come to a complete head. Most splinters have migrated to the surface. The bread and milk poultice got forgotten because lancing tools and antibiotics became the standard approach to boils and abscesses. But for the early stage boil that hasn't formed yet, for the deeply embedded splinter, for the infected wound that's beginning to close over impurities, this poultice does something remarkably specific. It doesn't fight the infection. It creates the conditions your body needs to resolve it itself. And that right there is the genius of the entire list we've walked through today. These remedies don't force your body to do something artificial. They work with your body's systems. They support circulation, immune function, barrier healing, and natural drainage. They're not tricks. They're accumulated wisdom from thousands of years of human beings paying attention. So there you have it, 20 forgotten remedies that every generation before us knew by heart. From the garlic honey ferment in your pantry to the bread and milk poultice that could be pulling out a splinter right now. These aren't curiosities, they're tools, and this knowledge is yours. Write it down, share it with someone. Try one the next time you have a chest cold or a sore throat or a stubborn wound that won't cooperate. You might be surprised how quickly you remember why people trusted these for so long. If these ancient secrets have changed the way you look at the ingredients in your pantry, please subscribe and like this video. We are dedicated to excavating the history and healing wisdom that they tried to bury. Join us as we reclaim the power of the past to protect our future. The next treasury of knowledge will be open soon.